Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Sam, tell me what's going on with your knee. What happened?
So again, when I'm walking or when I put some stress and
Weight on it or
yeah,
just
like when I drive long,
distance?
so this is I feel something
Like a pain
hurts
there?
me. Yes,
Okay.
not being like something like warm or something.
Fullness? Like pressure
Mhm.
inside?
Yeah,
Okay.
and I feel this is will be stuck like this, so I need to.
Stiff. So it's a stiff, you're not able to extend your knee. How long this been going on?
Uh, like 3 years or something.
3 years.
Yeah.
How did you injure your knee?
Like what?
How did you, did you fall? Did you hit it? Did you do
No,
anything? Just happened over
Yeah,
time.
welcome 20.
Yeah, so. So is it getting worse over the time or it's been the
Yes.
same?
When I,
Okay. So from 0 to 10, how much pain do you feel there? 0
When I-
is no pain, 10 is emergency
Like this,
room.
it depends when I carry some stuff when I
Hmm.
climb
With
up.
lifting,
Yes, lifting up.
climbing the
Yes.
stairs?
So
Okay.
this is like
At worst, how
sometimes-
much?
Sometimes like 8 or.
Okay. But while you're driving, how much?
I was driving with long like
Long
less.
distance?
Yeah,
Okay.
less.
But stairs, it's worse,
Mhm.
and with lifting. Okay.
Yeah.
Do you feel pain right now?
Yeah, because I step on the
How much pain do you feel right now?
4.
4. Where do you feel the pain?
Now when I start moving, I feel this is stuck like here and
No, so the patella is very stiff, okay?
it's need to.
Cracked. So he feel like it's stuck, the scar tissue, the fascia is compressing on it. He does not have much room to move it. So that's what he feel. I'm interpreting the condition based on the patient description, okay? So what kind of treatment did you have? You said like 2 or 3 years now, or how many years? 3?
Yep.
Okay. What, did you have any treatment for your knee? No. Okay. Y- how can we make it worse now? If I have you squat down, is it going to make it worse? Or if I have you lift something?
Yeah, left something.
How much weight?
I can carry some.
Okay, so let's carry a human being and see who's volunteer. I see a lot of hands raising now. Not really. Okay, so carry me. All right, so let's actually try to squat. I want you to bend. So you're gonna go down and tell me if that's painful.
Okay.
So if we cannot find a way to stimulate it, just try to do the range of motion, squatting, lunging, that's for lower extremity. Upper extremity, I will give them 5 pound, 10 pound and do it. If it's not painful, just do in the motion, okay? So let's squat and tell me, yeah. And let me know if it's from 0 to 10, how much. Yeah,
You heard me?
it's clicking. And it's raining too.
Yeah.
Yeah. How
You
much
can
pain?
hear it. I heard it.
How much pain?
Now like more 5.
5.
Okay.
Okay. What?
The other side.
But this is
But
the
that's
worst.
this is the worst? Okay. So it's on the right side. We're gonna do the same 10 like last time, and we're
Yeah.
gonna do 10 again. Okay.
Okay.
Sorry.
Okay, no worries.
If it's getting worse, actually, how much from 0 to 10?
Now?
Mm-hmm.
It's like now like 6 or
6.
7.
6 or 7. How many times did you do it?
Now?
5. 5 times? So 6, 7. So that's actually, it's going up.
Yeah.
Okay. The goal to do it 10, okay? All right. So where did you feel the pain?
Where?
Where do you feel the pain when you were doing?
I can't know exactly where.
It's
but
vary from
it's
time.
Something like this, something here, something
Mhm.
there.
Does that sound like the other case?
Yeah.
Yep. Okay. So let's take your socks off and everything pain free. So if you feel pain with what I'm doing, let me know, okay? And don't kick me, okay? All right. We'll have you lie on your back, head over there. Okay. Yeah, your back head here. So you guys gonna be very confident with knees now.
Yes.
Okay. So we'll put this here and roll it up. That's why I have on YouTube a lot of real treatment videos, because actually you can go on YouTube and say ASTR knee treatment, knee pain, ASTR plantar fasciitis, ASTR tension headaches or migraines or motor neuroma. So you can see all those cases, and it will make a lot more sense for you, to you, because you already know the foundation how to work on different things, you know. So, is that painful?
No.
You sure? You almost kicked me. Lift your head. How does that feel? It's okay? Mm-hmm. Yeah. Make sure it's not painful. So, comparing to the other case, the fascia is more tight here.
Okay.
Can you remember?
Like me?
Yes. So no two patients the same, even the same body part. It's everybody's different. So you need to customize the treatment based on patient presentation. You know, it's not one size fits all. Sorry, painful?
It's a little bit.
Slight, okay. But this is the whole area, because he said he feels fullness. So let's pull this up. Let me see. Slight swelling. Matt has more swelling, but there's a swelling here. Can you see it here?
Yeah.
Can you see the difference between left and right? Okay, so we see inflammation.
Yeah.
Okay?
Yeah.
And his description, it feels full. Full. Is that too much?
No, I mean the spot is over here.
That's the spot. So he said it's full. What could be full other than inflammation? That's what's gonna fill the knee space, knee joint space, prevent the joint from moving, because that space decreased. Because you need to have a space. I'm exaggerating. So if the joint like this, normal joint, I'm exaggerating with the space. So you need to have a space so things move easily. But if that space decreased, cracking and not a lot of range of motion. And that's what presented with a lot of cases. Too much? Okay. And it's raining today, so. You hear the rain?
Yeah.
How's that? Let's pull this up. So when you see cases back to back or similar cases, your protocol gonna change, because you notice something work faster on the other case, or you missed it on the other case. Okay? And I want you to pick on this. Okay? Because I'm trying to do the things that I explained in the class, but I don't do that all the time, just to not make it more like too much going on. But I'm gonna make it changes here. Let me know if you feel any pain. It's gonna feel cold, okay? How does that feel?
Okay.
Nothing here, it's just all on your
We go
knees.
from the top,
Here?
this area. Yeah, this is. That's what.
Okay, let's pull this up. Can you take your phone off? Is that okay? No, so this way I can, okay. Oh, you give it to me? Thank you. So generous, yeah. You see? You don't have to pay for treatment. I will take the phone. It's not too bad, actually. I'm gonna show you the scar tissue, actually. It's not too bad. You see how nice and smooth here? Is that painful or it's okay?
No, it's okay.
Okay. So everything is actually seem to be very smooth. Remember Matt case? You know, this is actually is fine. But I feel, you feel that grinding here? That's a scar tissue.
Okay.
Okay. And that's the patella tendon Technically should be called ligament here. This is a tendon. It's gonna compress on the patella. It's gonna push it downwards. So the same thing he described. It's stuck. It's not gonna move. The patella will not gonna move. But we visually can see the inflammation is not too bad because he's tolerating this. You know, is that too much? You feel that bumpy area?
Yeah.
All that scar tissue. You feel how nice and smooth here? No scar tissue. So I explain that to patients so they will be more intuitive to the treatment. Because when they are intuitive to the treatment, next visit they're going to tell you, I have a scar tissue here. They're going to be more compliant because they can tell the difference. So make sure you explain it to the patient how should feel without scar tissue or with the scar tissue. So the same protocol, you can use it for patella tendonitis. You have to really get the, if there is inflammation, you have the magna heal. If there is, you will find the scar tissue, so you have to really clear up the scar tissue in this area.
Yeah.
Too much?
No, but I mean, yes.
The spot, yeah. Too much here?
No.
And he has a scar tissue here. Okay. So I will try shortcuts, but don't like to show it in the class. Actually, I will have you. Are you comfortable lying on your stomach?
Mm-hmm.
Okay, so let's lie in your stomach. Okay. It's okay. Give me this to rest on. Okay, welcome. Oops, sorry. Too much?
No.
Okay. Sorry. Okay. How's that feel? Mm-hmm. Yeah, you guys probably need to have a higher table. I did not realize those tables are low, so it will be more ergonomically for you, you know. I don't use those tables, we just use it for classes, but make sure it's high enough so you really don't have to bend, okay? And we get the typical bend here. It's very common. Too much? Okay. Make sure you breathe, okay? We can't need patient to breathe while they get treatment. Okay. Too much here?
No, but the baby.
That painful or the tightness? Yeah, I'm right on the band, right in the band. So his band is that's the size of his band.
And you're looking for the center or the biggest spot.
We're not gonna say anything. Cut this area. Cut this part. Yep. Okay. Sorry. Okay. So because this usually is a little bit sensitive, so how's that? Okay. Okay, so let's, man, you got a lot of bands here. Am I gonna do all the bands? Just sometimes I do the important one. We'll do that later. Okay, and then next session I will work on more bands. Is that too much here? You feel that scar tissue here? Yeah. Sorry. So his calf is not bad actually. It's a little bit here. The paranoia on the side. Okay. Do you have issue with your feet?
Mm-hmm.
What's going on? When? When you stand for a long time. Does it hurt when in the morning, when you wake up in the morning, the first few steps? At night when you stand for a long time. He kind of like does not have really the best arch. So I will assess that and see, give him exercise to correct the arch, the exercise I showed you. So, you know, have you had any trauma or accidents, fall? You hit anything?
Yeah, I guess I broke my feet here.
He fractured this.
Yes, exactly.
In here?
Yes, exactly.
Okay. You see what I'm doing? So he fractured this area. How did he do that?
When I'm walking, and I'm looking for the little girl, so I fall down.
Okay, don't look around for beautiful girls, okay? That's what happened. You fracture your bones. Yep, okay. Lesson learned. So you stepped on it or twisted?
It's cracked like this.
Oh my goodness, that's
It's a
painful.
small hole.
Oh, so it's entrapped in the hole in the ground. So his dorsiflexed. Wow, man. Sorry about that. That's not fun. When did that happen?
In 2015.
2015. Mm. Oh, is that your knee start to happen after this happened?
Yeah, I guess.
Compensation. He started to compensate. Now we know what happened to his knee
Yeah.
because he did not hurt his knee, but he was compensation. So you were in a cast and.
Okay, I will tell you the whole story. So I broke.
Uh-oh, there's more story? Oh boy.
I did stupid things.
Yeah.
So I broke my feet like here, exactly like this.
Mm-hmm.
So and I walk with the broken feet.
Mm-hmm.
15 days, all month.
Without cast?
Because I'm working with the Google Earth, so
Mm.
filming some in the mountains, so
Ah.
I can't put it in. So this is my job, so I'm gonna lose my job. So I started walking,
Oh, you
walking.
precious, sorry.
With a broken foot.
Sorry about that.
Yeah. So
Feet.
Feet.
Foot.
Foot.
Yeah,
What is it?
man. Which one of them? Yeah, it's one, it's not both. Okay, I hope you did not break both.
One foot.
One foot.
it's exactly.
Two feet.
See the bones
foot.
here?
It's lying.
It's a bone.
Let's.
Oh,
Let me actually clean this up.
And
now.
how long did
So it was more sticking out, and he fractured it more. What happened? Say that again. Let's explain that again. Foot or feet?
Okay. This is foot. So,
No, I'm joking.
I guess. So when I'm walking, just there is a small, really tiny hole like this. So when I'm walking, so
But your feet stepped on it.
this and this.
Oh,
Keep
yeah,
going.
plantar flexion.
Yeah.
Extreme plantar flexion. Okay.
So here,
Oh man.
so as I'm strong, you know, this
Yeah.
is like our culture doing this, no?
Yeah, just suck it up and keep
Yeah.
going.
Yes.
Yep.
So
So,
I start walking,
so your bone was sticking out more,
I guess, yeah.
Oh.
Out.
and your
No,
Not
but,
out.
yeah.
but it's so the doctor crack it back in.
After 1 month.
Oh.
Ah, it was growing
Did he
again.
do like
Yes.
under anesthesia, or he said just close your eyes and?
No, he don't like to give me a bad
Injection?
the news or something. It's just
Yes.
uh,
Yeah.
once. I
Oh.
scream
No,
it.
you don't mean it.
I
Okay,
scream it.
You hit him?
I
man,
scream it like the
Yeah.
pregnant.
lady.
In the mouth.
Okay.
No.
What a
So
robot.
after that, did they put you in the cast?
Yes, of course.
Mhm.
And
For how long?
it's like
6 weeks or more?
than, I
Yeah.
guess.
So you fractured here and here, or here
Yes,
only?
but this is the spot, the
Oh.
main spot here. Of course, it can affect it.
Yeah. So you have the issue there. All right. Anything
So
else we
starting
need to know?
Walking like this.
Oh,
one
so he was looking on the outward
Yes.
part.
climb the
Yeah.
filming. This.
That's
Yeah.
why you pulled or something like
So now we understand
Yeah.
why.
Yeah, why?
Yes. Okay. Now that's explained why he has the issue.
So
Right.
you need to replace it.
Well, we're gonna get you a new one. Don't worry.
We
Slide
broke it
it
again.
back. Yeah. Well, this time we'll have you. This time we'll have you close your eyes, and we'll have two people tie you to the table so you cannot scream or walk. And we have a scotch tape, we can put it in the mouth so you don't scream. We don't have any of these, okay? We're working on it. Is that painful or it's okay? Okay. So he was walking outward in here, so he started to have compensation in the knee. Well, typically, I usually, because he did not complain of walking, I did not do gait. But in real life, I actually have patient walk. That's part of the assessment. Here, I'm just trying to work on patient quickly, like with Matt, or evaluation has to include gait. But I just try to, just do the manual stuff here. But you should see the gait for all lower extremity, period. Too much or it's okay? All right. Make sure it's not painful.
Walk on mountains.
It's too much. I don't know. How can he do? It's rough. That's not easy. Okay, let's get him some water. Oh, you have water? We'll get him. This is yours? Yep. You're welcome. You can sit up and tell me how that feels. All right. Did you break anything else? No? You did not break a glass or anything? Okay, let's have a seat here.
Let's clean this.
Yeah. Here you go. Okay. All right, so you were saying your pain was just sitting there and was squatting. Can you feel a difference now? From 0 to 10? Typically, I usually take the range of motion. Did you have any issue bending? Oh, we should have taken that. Bending your, do you have issue bending like this? Like doing this?
Oh, Ramadan, of course, I can't.
You can't. Lie on your back. Man.
Like this.
Okay, so let's
But
do
I
it here.
I can't here because I feel this is gonna.
It's gonna pop. Okay.
Yeah.
That's where do you feel that pain?
Now when I try to stretch it, I feel this gonna be cracked, so I make it slow. See?
Oh.
Can you hear?
He has a lot of internal inflammation. So internal inflammation, you can relax. This is a very good case that you're gonna work on inflammation, you're gonna work on the whole protocol, Especially when they say internally feel fullness like this, we need to get something that's really go deep. Okay, try to bend again and tell me how that feels. Mm-hmm. Any difference? Okay.
I still have a bad memory.
Let's do it 10 times.
I still
Okay.
have a bad memory too.
Yeah, but let's do it 10 times. And stop before you feel pain, okay?
Okay.
How's that feel? Relax your head
Okay.
and think about something you like, okay? And do it 10 times faster. Pain-free, okay?
But I still hear it.
Well, you're gonna hear the sound until we totally get the inflammation down and release it. Sound is okay, gonna take time for that. Pain is not okay. How's that?
This is more comfy. But
How-
I start to feel it.
The tightness or pain?
No, tight.
Where do you feel the tightness?
Top.
Right on the top. So that's another patient, we'll give them Magna Heal. Right in here or here?
Exactly the top.
Right in here, okay. So we'll do that. But did you see, he did 10,
Yeah, I can't.
So he was like, the first time he used his hand to really bend it. And we're gonna try a squat. Oh, you're next? Okay. You're perfect? Okay. Oh boy, okay. All right, we'll work on it. Wow. Yeah.
The next patient.
Everybody. So you see, everybody need ASTR treatment. You know.
Yeah, but everybody has pain. It's not.
Well,
No,
but
not
you
really.
can
No,
control the
no.
pain.
Huh? You have nothing?
Oh no, just higher.
Just tie it. She feel
Oh,
tight.
she's tired. Oh yeah.
Yeah. Okay, let's bend it again and tell me how that feel.
Much easier.
You count. How many times?
4,
5,
5.
You see the speed.
Oh,
Yeah,
it's
7,
so quick now.
8,
Even
Nine.
I crack it. It's
10.
Decrease the crack. So it's
Yeah,
a, it's classic inflammation. That's what I use, Magna Heal. Let's stand up and tell me how that feel. Last time we did the squat, so we'll try the squat again. So if he has inflammation, he's gonna feel pain. I will
Yeah.
give him
Yeah.
the Magna Heal. If not, well, he has inflammation to begin with. So okay, so let's squat like bending. And count and tell me how that feel. Can you tell a difference?
the other one is 30. I can't feel
Okay,
anything.
we're gonna do it.
Fix it. Fix it now.
Next time, next session. Stay tuned, next video.
Yeah, we will work there. Knack.
6, 7, 8.
You see how fast he's doing it now?
10.
Okay.
Any pain?
No.
First time, how many squats he did, and we stopped because it was painful. It was 5. Now we did 10, and he did it very fast.
Wow.
Are you trying to show off now?
No.
You can have a seat. So now, well, this is your first
Can you fix the
ASTR
other one?
treatment. Well, we'll work on it. Yeah, yeah. So what do you think about ASTR treatment? What you just had for a few minutes?
It's like a miracle.
Mhm.
Yes,
Yeah,
really.
yeah. Do you feel pain now, or it's okay?
No, I feel good.
Okay.
Can practice on
Now the patient singing to you. Okay. That's
yes,
good.
really, really hurt
Yeah.
this, especially in this area.
It used to hurt you, yeah, but now it's fine.
Yeah.
All right, awesome. Thank you so
Thank you,
much.
doctor.
Thank you.
Thank you.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.